Hi everyone. Hi everyone. Welcome to our Lunch and Learn. Today we will be talking about protecting our family's health. What do the proposed federal changes mean to Medicaid for kids and families in our state? Today I want to welcome Joan Alker from Georgetown Center for Children and Families. We work a lot with their team on our Medicaid work and just really grateful for the work that they do and the work that we get to do alongside them to protect Medicaid for Utahns in our state. Utah has approximately 200,000 people in our Medicaid program, and about 46% of our Medicaid program is kids. So we know that this is deeply important for kids in our state, and of course the parents that they're part of their families. And so with that, I first want to let Joan introduce herself and just give a little bit of a introduction to herself. Thanks so much, Joan.
Thanks, Syriac. It's great to be with you. One of our long-standing and most wonderful partners at Utah Voices for Children. And I see a few of my other Utah friends on the squares. So great to see you, although I wish we had a better topic. So obviously I'm Joan Alker. I'm the director of the Center for Children and Families and a research professor at the Georgetown McCourt School of Public Policy. And you can see I put on my official background for today. It is our 20th anniversary this year, which, is great, except it's not a great year. But we really were established at the public policy school to be kind of a hub for technical assistance and public policy analysis um, with a mission. And our mission is to ensure that all children and families have access to affordable, high quality healthcare. So that's how we got started. We are 100% externally funded at the university, which means basically that we raise our own money. And we have pretty strict guidelines that I follow. That I should say these are our own guidelines. These are not the university's guidelines about our funding. And so we don't accept any government funding and we don't accept any corporate funding because we want to be able to really just engage in the public policy discourse from the perspective of how do we make life better for children and families, and we want to have a very clean line in on that. We know we've got a lot of money in our healthcare system from a variety of places. And we're fortunate that we've had the support, largely of major health foundations to allow us to pursue this mission. And a lot of what we do is in partnership, which is a critical value for us, working with folks like our partners here in Utah. So that's a little bit about what we do since we are focused on children and families. We are largely focused on the Medicaid space and the Children's Health Insurance Program. We do a little bit of work outside of that, but we have another kind of sister center at Georgetown, the Center for Health Insurance Reform, that focuses more on the marketplace and private insurance reform. So we work jointly with them on that. So because Medicaid and CHIP are so critical for children nationwide, they cover about half of children in this country. So having a strong Medicaid program is absolutely essential for children, their families, their caregivers, and their communities. So that's why we spend so much time working in the Medicaid space. And as you all know, Medicaid is a very hot topic right now, which is why we're having this discussion. So I'll hand it back to you, Syriac.
Awesome. Yeah, 100% agree, Joan. And I think this issue is not only relevant, but I know we've gotten a huge response from our community members, from our partners to really understand what's going on. And also, I think I forgot to introduce myself. So hi, everyone. If I haven't gotten a chance to meet you, I'm Syriac Alvarez. I'm a senior policy analyst at Voices here at Voices for Utah Children. We're actually in the office today and care deeply about our healthcare policies and the intersections with our immigration policies and how they impact kids in our state, including kids in rural areas, kids in urban areas, kids all over the state. And so we really wanted to host this lunch and learn to get everyone kind of up to speed about what the real impact of some of these proposed Medicaid cuts will have on our state and why it's so important and why it's really impactful for each one of us to be able to take action today. I don't know if you guys can see it, but I do have a button today that says I love Medicaid because I, like Joan, think that Medicaid is such an amazing program and it has really been impactful to kids all over our country throughout for a really long time. And it has proven time and time again through research that Medicaid works and that Medicaid for kids really helps the long term health of our children. And so we're gonna have a conversation, but first, Joan, I'd really just love to ask you, like, what is this big, beautiful bill? Though I don't think I would call it that. And just, yeah, if you could tell us a little bit about what's in this bill that we have being proposed. And I know a timeline wise, it just passed the House of Representatives. So if you wanted to give just any other timeline information, feel free.
Yeah, sounds good. So, as one would expect, when you have, after an election, you have one party controlling all branches of government, the House, the Senate, and the presidency. That first year is always the year that we see a major piece of legislation move forward. And typically that happens through the reconciliation process, it's called. That is, without getting into a lot of wonky details, but bottom line about the reconciliation process is that it has kind of privileged floor status in the Senate, whereas senators can filibuster, and 60 votes are required to overcome a filibuster. But with the budget reconciliation bill, 60 votes are not needed. 51 votes are needed, and actually, in the situation we're in right now, only 50 votes are needed because the vice president can break the tie. So that's why the Republicans right now are moving, what they consider to be the top priorities of President Trump's agenda in this reconciliation bill. And it's moving very fast. It is officially called the One Big Beautiful Bill. That is its official title. And in general, what it's doing is obviously moving forward affirmative priorities like for the president, like funding his immigration agenda, more ICE agents, things like that, increasing the defense budget, extending tax cuts that are due to expire, as well as adding more tax cuts on top of that. And so those are kind of the pieces that he campaigned on. And the bill actually does add over between $2 and $3 trillion to the deficit. As passed in the House, it is not paid for by any stretch of the imagination. But to the extent that it is paid for by making cuts, those cuts are really directed at low-income families and people. And so Medicaid is one of the ways in which, and we anticipated this would be the case. You may recall during the election, there was actually no discussion of Medicaid in the presidential campaign by either candidates.
Mhm.
And that was something I kept saying to the reporters, ask them some questions about Medicaid. But anyway, there was no conversation about Medicaid. And President Trump said that he would protect Medicare and Social Security, but he didn't talk about Medicaid. So no surprise to us that Medicaid was top target for cuts. And indeed, the bill, as it's moving forward now, has about $800 billion over 10 years in Medicaid cuts. That is certainly by far the largest cut in Medicaid's history. There are also cuts to the Affordable Care Act marketplaces And so together, that's about $1 trillion of cuts to healthcare. They're also, I think about 300 billion, but don't quote me on the numbers. Syriac probably knows better in SNAP cuts, that's nutrition assistance. And there are other repeals of energy, green energy, tax credits, things like that. But really, to the extent, again, that cuts are tax cuts, which will disproportionately benefit wealthy people, are paid for. They're coming off the backs of lower income families and people. So that's kind of the big picture on the bill. Let me talk now about the timing and where we are in the process. So the House moves first, as is the way, and the House moved their bill a couple of weeks ago. It was an incredibly fast process. I can tell you for the Medicaid provisions, um, we got the language that the committee was going to consider at 10:30 p.m. on Mother's Day. I remember it very distinctly. And so we were sort of frantically reading these provisions. There were 26 Medicaid provisions in that language. And the committee that has jurisdiction over Medicaid in the House started their markup, which is essentially when they go through and, vote on amendments, things like that. Which, by the way, basically they made no changes in this process, but they had a markup that started at, I think it was 1 p.m. on Tuesday after that Sunday night. And the markup itself went all through the night. It was a 26-hour long markup. Um, and I mean 26 hours, like there was no break. And I personally, I am kind of a night owl, so I had been up reading the language Sunday night, and then Tuesday night I stayed up till 1 a.m. again watching, and they had not even got to Medicaid yet. So they they started Medicaid literally in the dead of the night. And it was so rushed that the Congressional Budget Office, which is the nonpartisan scorekeeper, had only scored 16 of the 26 provisions. They hadn't even had time to actually figure out what the language said. Some of these provisions are, very new, not been drafted before. So it's a pretty crazy process. There are a few changes that actually made the bill tougher and deeper on Medicaid cuts when the bill went to the floor to appease the House Freedom Caucus, and then the bill passed by one vote. So the Senate now is the bill is in their lap, so to speak. They're just now starting to release their language. They certainly will be making some changes. Unclear how substantial those changes will be. We're hearing sort of not hugely substantial, but they certainly will make some changes. Right now, we're hearing we may get the language about the tax cuts and the Medicaid pieces Friday night or over the weekend. Um, and their goal is to get it to the Senate floor the week of June 24th, 5th. Vote on it later that week. It has to go, it will not go through committee in the Senate. We're not anticipating any committee markup in the Senate. They're going to take the bill right to the floor. And that if they pass it that weekend, that's right before July 4th, the week before July 4th. And so the House will have to vote on the Senate's bill, assuming, and there certainly will be some changes, right? The House has to adopt the exact same thing. And they are supposed to go in recess for the week of July 4th, but the rumor is they'll keep them in, they'll jam them to just, get the bill through. And then the president wants it by July 4th so he can sign on July 4th. So that's a very ambitious timeline. Um, it's possible they'll keep to it, but the president said, I think yesterday, that he won't mind if he doesn't get it by July 4th. So it's possible it will slip. They have, if it does slip, they have a sort of another deadline of mid-August. We would expect them probably to work through the month of July. They are planning to raise the debt ceiling in this bill as well. And apparently we're going to hit the debt ceiling in mid-August, early September. The Department of Treasury has to opine on that, and that's sort of what they've said. So anyway, still some uncertainty about the timeline, but they're certainly aiming for a very quick timeline. Let me stop there, Syriac, and see if anything you want to add or other questions about the timeline and the overall bill.
Yeah, I mean, I think first there is a lot of rush that I don't think is necessary. I think there's a lot of pieces that as we like keep having this conversation on some of those specifics that there is some uncertainty in how it will be implemented because the language is so vague or like how much of it will impact, right? Like everyone, because again, the language was written somewhat fast and some of the like what you were saying about the CBO score, I just think there is a lot of like uncertainty based on some of those pieces. And I mean, even the dead of night, like vote, I know our representative Moore got a little bit of heat for falling asleep because again, like they were up all night, all day, 26 hours, and it seems like maybe not the best way to pass policy, like for all of us to keep up. And I think we're all just trying to really understand like what it is that is going on. And so I think again, just like this conversation is so timely because we are like really thinking about this day in and day out, but I don't know if everyone on this call or even just like in the general public is really thinking about the impact that this bill will have on them, on our community, and on right like low income families, whether they are going to use these programs now or in the future. And so yeah, that's the only other thing that I would add. But when we think about just the different provisions, I'd love to ask you, one, how parents will be impacted by this bill, because we know that there are a number of provisions, including, right, like work requirements that will be added. Although Utah does have its own work requirement that is being proposed. And yeah, I would love your take on one, like how you think Utah will be impacted by the work requirement and just how that intersection or connection between what Utah is proposing already, like if a state already has a work requirement, what your thoughts on or how that will be implemented afterward. And then the other piece, just on the redeterminations, because we know that is also a piece that will impact a lot of parents. If we increase the number of times that someone has to prove, right, how like that they are eligible for Medicaid throughout the year.
Yeah, so I'll get into some of those specifics, but let me kind of do like very broad buckets on what are
Mhm.
the types of cuts that are in this bill to Medicaid. And it's very complicated, and as Sarah mentioned, it's troubling to move so quickly like this on Medicaid, which is such a essential, literally life and death um, aspect of people's lives, and also very complicated. I can tell you we have some really sharp Medicaid minds at CCF, and um, we puzzle over this language. It's very hard to figure it all out. But clearly there are some buckets here of where they're going. So there are a number of cuts and proposals directed at the Affordable Care Act Medicaid expansion. That's the adult group below 138. As you all know, Utah passed that on the ballot. So there are a number of proposals directed at that group, including the work requirement is the most famous, but there are other proposals. There are a 6-month renewal policy for all adults in that group, as well as increased copays for adults be from the poverty line to 130% of the poverty level. There's also a really important but especially complicated set of policies that are designed at limiting the ways that states raise their share. So Medicaid is a federal state program, right? And states put up their dollar and they pull down depending on the state's match rate and the population. But in the case of Medicaid expansion, they pull down 90 cents on the dollar, irrespective of states. But otherwise, they're different matching rates. But in any event, so the states have to put up their own money. And there are a lot of policies in here that are designed to limit the way states can do that related to taxing providers. And all states do this except for Alaska. It's an important piece of the puzzle for them. There are also limits on how states can do reimbursement payments to certain providers called directed payments. So all of these are very complicated policies. And that is like a part of the bill that we're super worried about. It's one of those things that's really complex, and they're doing this quickly, and I think it's going to have very big implications for states and state budgets, which we can talk about in a minute. Another theme is that there's just going to be a heck of a lot more red tape in Medicaid if this bill passes, both in terms of sort of the marquee policy, if you want to call the work requirements that, as well as more renewals, but also there's a repeals of some Biden era regulations that were really designed to reduce red tape, especially for people with disabilities and seniors. And we're also going to add some protections to children in CHIP. Those would be repealed. There are a lot of anti-immigrant provisions in this bill as well. And then there's a lot of ways in which these kind of themes intersect in certain provisions, but those are the themes I wanted to mention. So in terms of the work requirement and also this renewal provision. So, um, another thing we should probably talk about is sort of the talking points on this and fraud, waste, and abuse, right? Because
Mhm.
that's the claim here that they're, both getting rid of spending on illegal aliens, their words, and they're eliminating, they're going after fraud, waste, and abuse. So, unfortunately, that's just misinformation for a lot of reasons. But on the fraud, waste, and abuse, does Medicaid have fraud? Sure does. Does every health insurance payer in our system have fraud? Yes, they do. We have bad actors who submit fraudulent claims and do bad things, and we would all like that to be cracked down upon, right? Everybody would benefit from that. But people who get Medicaid, who are covered by Medicaid, are not, they're the victims of fraud. They are not the perpetrators of fraud. And we did an analysis of the proposals in the bill and the savings that accrue from them, the cuts, and only 3% of the roughly 800 billion come from proposals that actually target fraud, waste, and abuse. For example, oh, we've got dead providers that are still getting paid. Okay, that's just like a talking point. Congressional Budget Office scored that basically at zero because states already do that, right? So there's a lot of this rhetoric about fraud, waste, and abuse, but when you really look at what they're doing, because there are things they could do, and frankly, that would be great if they would do them. For example, they could beef up state fraud control units. They could hire more prosecutors, Department of Justice, right, to go after fraud, but that's not what they're doing. Most
Right.
of the savings are from taking people's coverage away. And we know from the Congressional Budget Office that about 8 million people would lose Medicaid under this bill and become uninsured. And of 4.8 million, the Congressional Budget Office estimates would be from the work requirement. So that would be the biggest contributor, and another 700,000 from this 6-month renewal. And again, these really are people who are eligible, but they're losing their coverage because of the red tape. So let's talk more about the work requirement for a minute. So, those of us who were around in Trump 1, this was their big policy. This is promoted at the state level by the Foundation for Government Accountability and some related kind of right-wing think tanks that promote they don't like Medicaid, they don't like government spending money on Medicaid, and this is sort of one of their marquee policies. So we had states try this, and Trump 1. Only 2 states have actually implemented this, Arkansas and Georgia. The courts largely stepped in and said this is illegal because it's taking away health insurance from people. And the point of Medicaid is to give people health insurance, not take it away. But of course, if Congress changes the law and requires a work requirement, those kind of legal claims won't exist anymore because Congress has changed the law. So what this bill does is that whereas in the past this approach has been a state request permission to do it, this would mandate a work requirement on every state in the country, whether they want to do it or not. And essentially, it applies to all adults in the expansion group. Just noting for the record that when Arkansas did this, they cut it off at age 50 because there's a lot of folks from 50 to 64 who have a lot of chronic health conditions. But this bill takes it all the way right up to 65. So, and they did that just to generate more savings by having more people lose coverage. So every adult in that expansion group will be subject to this. It is a 20-hour a week requirement. There are lots of exemptions, and you can read them in the bill. There's exemptions for people who have dependents. There's exemptions for people who are caregiving. There's exemptions for people who have SUD conditions, et cetera. Lots of exemptions. So that sounds pretty good, right? Like there's all these exemptions. Unfortunately, the reality is that all of these exemptions don't actually happen in the real world, and they're very hard for states to make happen correctly. And they're expensive, actually. They're really expensive, as we've seen in the state of Georgia, which
Mhm.
has a work requirement right now. They started a program to offer coverage to people who could jump through these hoops. They've only covered about 5,000 people, and 80 to 90% of the taxpayer dollar in Georgia has been spent on administrative costs to create these barriers. Most of that money, millions and millions of dollars, has gone to Deloitte, a large corporation, to set up these complicated systems. And it really requires government to kind of know lots and lots of things about your life in order to qualify for one of these exemptions, and for government to work very smoothly in figuring this out. And that's just not how reality works. I think this would also potentially create a lot of paperwork burdens on doctors and other providers who may be called in to say, oh, well, this person really can't work, be put in a tough spot because either they have to tell their patient, you can't work, which is a hard thing to say to your patient. Maybe you don't want to say that, or you're going to lose your health insurance, right? So a lot of ethical considerations here for doctors. No one's talked about that at all, as far as I can see. And like I said, every state has to do it, and there are no waivers of this provision. States cannot get out of this.
Yeah, I mean, it seems like one, like work requirements across the board sound good, right? Because there is importance to working and helping people, right? Like access jobs and things like that. How would you differentiate that from like what is being proposed right now?
Yeah, that's a great question, Syria, because, as I always say, like it's perfectly fair and legitimate for government to want to support work. That is a perfectly reasonable public policy goal, but this is not the way to do that. And in fact, this is probably going to have the opposite effect of hindering people's ability to work. Because if you want to address people's barriers to work, right, there are actual barriers like affordable childcare, transportation, jobs, adequate jobs, available jobs. And then there's people's health conditions, which can prevent them from working, right? And so, when this policy was tried in Arkansas, and this has been studied pretty extensively, there was no impact on unemployment at all. It had no impact on that. And there's some limited evidence from a couple of other states like Ohio that was starting to look into this, that people actually, at least as people report, having health insurance so they can address their chronic conditions, if they have a mental health issue, SUD, whatever it is, helps them be able to work, right?
Mhm.
If they can get those health conditions under control, they're better able to work. And the reality is, a lot of these low wage employers just don't offer health insurance for folks who are working part-time in the service sector, agriculture sector, whatever it is. They're just not offered coverage. So a lot of them are working, um, but they're not getting coverage on the job.
Right, right. And not to mention, when we think about work, I think sometimes like for example, because I work a regular stable job of 40 hours a week, like it's very consistent. But some of these other, whether you work at a restaurant or you work, right, like somewhere else, sometimes your hours can fluctuate. And you may not necessarily work 20 hours a week every single week. It might be 19 or 17 or 25, right? Because you took on an extra shift. And I think those are the pieces, Joan, that you're like talking about, how like not everyone is going to, right, like meet these needs. And of course, as voices for Utah children, we think about parents too, about transportation and what you mentioned about childcare, and really thinking about those barriers to work for someone. And while there are exemptions for some parents, I do think that they, again, like there is still some hurdles that some of these people will have to go through to, right, prove that they are working or prove that they are exempt from some of this piece. Um, One thing that I would love to ask you about, Joan, is rural communities, because one, with this work requirement, of course, there is some barriers for people in rural areas to find jobs, right? There just may not be as many opportunities, both for jobs or for volunteer opportunities, or even like training or programs. But I know like we are trying, but I do think there are some impacts that will happen to rural communities even outside of the work requirement.
Yes, 100%. So we've done quite a lot of research on this for many years at Georgetown. And as important as Medicaid is nationwide, it's actually even more important in rural communities. When
Mhm.
you look at the reliance on Medicaid as a health insurance provider, children and non-elderly adults actually rely on Medicaid at higher rates in rural communities. And that kind of makes sense because unfortunately, rural communities are not doing as well as metro areas. Their incomes are lower. They have higher rates of disability. They have greater healthcare needs. So there are a lot of concerns. I think I know we've worked closely with quite a few folks who are work at rural hospitals, and they're extremely worried about many things in this bill. Some of the limits I mentioned on provider taxes, those can be very important for rural hospitals. And many of them are very concerned. We've seen a lot of rural hospitals close. We've also seen a sort of very scary decline in labor and delivery and OBGYN capacity in rural hospitals, to the point where now the majority of rural hospitals, 52%, have no labor and delivery capacity. So that is scary. Medicaid pays for 47% of births in rural areas, about 40% nationwide. So it's critical. And if you don't have a safe place to have a baby, it doesn't
Mhm.
matter what insurance you have, right? You can have the best private insurance in the world, but if there's not anywhere safe and close by to have your baby, these rural communities just simply cannot grow and thrive. So there's a lot in here to be concerned about for rural hospitals. They are extremely concerned. And I don't know what to say about that. It's very, very scary.
Yeah, agreed. I think the something that has been, just reiterated is how much money we're going to be saving through this budget reconciliation process. However, what it really seems to be is a shifting cost, right? Like we are still going to have births, we are still going to have people need healthcare, we are going to still have all these doctors, right, that need, like you were saying about the provider tax. Like there's still like the money still like may have to be spent, and so I'd love to hear just like how you think this budget, the process, this reconciliation budget process will impact our state budget, because there is going to be a lot of impact and shifting costs to states like Utah.
Yeah, absolutely. And I think this is really an important issue, and it's hard to kind of break through and have conversations about this. But as you say, people's healthcare needs don't go away just because Congress makes big cuts to Medicaid. And I think really because states run Medicaid, right? So governors and state legislators are ultimately the ones who will be left here to implement these cuts. And so there's sort of a kind of a neat trick here, right? Where where Congress cuts it, but governors are the ones who actually have to make the math work. And of course, states have to balance their budgets. So it's important to think about the bill in totality here because one of the proposals related to SNAP, nutrition assistance, is for the first time to ask states to pay a chunk of those costs, which they've never done before. So that is a direct cost shift to states. And then on the Medicaid side, of course, we have, again, lots of folks, particularly in expansion states, who are expected to lose coverage as a consequence of the bill. And these limits on the way states can raise their revenue using provider taxes. Those are essentially frozen in place on the date of enactment. And Utah, like every other state, uses provider taxes. And over time, as you all probably know, Medicaid, one of the many roles it plays is that it is the largest payer of long-term care. Medicare does not cover long-term care. And so Medicaid does, and that's actually the majority of Medicaid funding is used for seniors and people with disabilities. And we have an aging society. And so over time, this is going to get even tougher for states. There will be an immediate impact that will impact state budgets next year. But over time, this is the squeeze, I think, on state budgets is going to get tighter and tighter. So they'll be left really to manage the unmanageable. And the only choices they have are to raise taxes a great deal, cut Medicaid, or cut other aspects of their budget, education, law enforcement, roads, whatever it is.
Yeah, thank you, Joan. Yeah, I think the impact that will be seen over the next 10 years is substantial. And we were talking with a colleague, just like for, children, those first 10 years, right, are critical in terms of long-term health and just like the impact that it will have on our state, particularly with one of the highest rates of uninsured kids in the country, worrying about that trend, right, going backwards again. And so really appreciate, yeah, just all of the different pieces that you like talked about. Before I ask my last question, I did want to just offer that if anybody would like to ask a question, feel free to put it in the chat, and we'll spend the last little bit answering just questions from the general public, and then if anyone in person, because we have a couple of folks in person would like to ask, we'll also give some time for folks. But I guess the last question, Joan, is really just one of the issues that you brought up was on immigration and the impact to immigrants in our state. The budget, the act has a number of provisions that includes greater immigration enforcement and more funding to Department of Homeland Security. However, there are also a number of provisions that are going to impact immigrants in our state that access healthcare. Utah has a state CHIP program that covers immigrant children, regardless of their status. It also has has opted into the option to cover legal permanent resident children who haven't been in the country for 5 years, and a couple of others. And just curious about the impact that it'll have on Utah when it comes to this provision. Some of the provisions, sorry.
Yeah, so there is a number of provisions that intersect here, and in the language, actually sort of changed in between the committee and the floor. And I'll just also say that the mashup of Medicaid law and immigration law is really scarily complicated. And so, and I don't pretend to even come close to understanding much about immigration law, but one of the I'll say most talked about provisions of the bill on the House side and the energy and commerce markup that was really kind of a main talking point for the proponents of the cuts is that, oh, well, states are, our Medicaid funding is going up because we're covering illegal aliens. Okay, that was a main talking point of the bill. So let's unpack that a little bit. So Medicaid, and when I say Medicaid, I mean the federal program Medicaid. That's Medicaid is a federal program. It was started 60 years ago. Um, it doesn't cover undocumented people. Federal funds are just not available for that, with one exception that we'll talk about in a minute. So it's just incorrect to say that Medicaid spending is going up because these folks are getting covered, because they're not. They're not covered with federal funding. Some states have chosen, primarily for children, but in some cases, adults, to use their own taxpayer dollars to cover undocumented people. And what the bill does is that it imposes a 10% penalty on the federal matching rate. So we talked about that in the beginning. States get 90 cents on the dollar for the expansion group, and it would impose a 10% penalty on states that are using their own funding to cover undocumented people, bringing that down to 80 cents on the dollar. So that's a very big penalty for states. And I would anticipate that, if this provision passes, they have to drop their coverage for undocumented people. And again, it's well, for most states, it's just children. Now, when the bill went to the floor, they fiddled around with the language a little bit. And it appears that this penalty would also apply to states that cover lawfully residing children under their CHIP programs. Even though that is, a federal option that's been in place since 2009, we hear that was a mistake and one of these sort of things that happens when you're rushing in the middle of the night. So we'll be keeping an eye on that language as the Senate moves forward. But in any event, Utah would be subject to this penalty, irrespective of that. So I know, this is, I think really, like I say, is in there to drive their talking points. It's not a huge saver in terms of, like, compared to the work requirements. I think it saves maybe like 11 billion. The work requirement cuts 334 billion, right? So it's not, it's really a talking point driver in my view. But I would imagine that will stay in, and it will really put pressure on states to drop this coverage. I don't see how they cannot drop it. Now, having said that, there are a lot of legal questions here, right? Because this is, and I'm not a lawyer, but some of you may recall in the Affordable Care Act, when that was challenged, the Supreme Court ruled that states could not be mandated, even with 100% federal funds in the beginning, to do Medicaid expansion, which is why we ended up in this state by state fight, right? And Utah adopted through the ballot. So the Supreme Court has already said we can't mandate states to do something with 100% federal money, even though the feds are picking up the cost. It seems hard to imagine, but not impossible, that the Supreme Court is going to say we can force you to do certain things with your own money. So I think that's the rub here, and we'll just have to see what happens.
Yeah, agreed. I also think, just like on the bigger scale, yeah, like tying a state's hands on how it's using its state dollars, to a program that isn't connected to Medicaid is also part of that like legal question. And I think for Utah, like Utah values have really been centered on compassion, and covering more children is a compassionate but also a smart decision, right? Like where we save dollars because we get children the access up and care that they need in preventative services, in chronic care condition, and taking care of chronic conditions and not in emergent situations. And so not only is it smart fiscally, right? It's also it has been the right thing to do for our state. And so yeah, I am also curious about the legality of like how we can force the state to do something or not do something, especially when it's something that has been really impactful to children in our state. I mean, when we look at our data, the majority of the well, we had like 1,500 wellness visits over the first year of the program being in use, and like over 600 immunizations being given to this population. And so it really has been doing its job of getting people and getting these kids the care that they need. And so this is one of the key issues that we're really looking at. So thank you, Joan, for that background. Um, I'm not seeing any questions in the chat just yet, but I will see if anybody here in person has any questions. Yeah, okay, we have one here.
Joan, thank you so much. I think you've given us a lot that will help us in our advocacy. Like, I feel like I've learned a lot here today. My other question is that if this bill passes, we're gonna have a lot of people who are hurting. Maybe I'm premature, but I'm wondering if there are things that we can do in order to help them that we should be planning and preparing now. As communities, not maybe like here we are, Voices for Utah Children. We can do things, but how can we also advocate or take action as larger communities to help the effects of the bill if it passes?
Yeah, no, that's a great question. I mean, I think right now, obviously, this isn't a done deal. We don't know what's going to happen. A lot's going to happen in the next few weeks and possibly a few months. So that's sort of where to keep the eye on the ball for now. But once, assuming that something passes, you're going to have to move very quickly to thinking about implementation and mitigation at the state level. As I said earlier, I don't think there's any way for states or philanthropy to make up the kind of losses that we're going to see here in terms of dollars. And one of the unfortunate things, and just sort of I guess one of just Syriac, your comments made me think about Utah's values and the choices the state has made is that, traditionally Republicans have been very focused on state rights, but there's a lot in this bill that is exactly counter to that. Like not only this, you can't spend your own money this way, but also, like mandating the work requirement, right? I mean, they could make the work requirement an option. But that's not where they're headed, in part because that wouldn't generate as many cuts as they want to fund their tax agenda. So there are going to be a lot of issues to think about here in terms of particularly related to the work requirement and some of the other provisions, like the 6-month renewal. One of the changes went to the House floor was to move up the implementation for that. That was originally slated to be implemented in 2029, which was interesting because, of course, it was after the next presidential election. The damage wouldn't start happening until after the next presidential election. But also, that was certainly intended to give states time to get ready for this really complicated system they're going to have to set up. But that was one of the things the Freedom Caucus demanded. So currently in the House bill, the implementation date is no later than December 31st, 2026. So that's going to happen very quickly. That will be an issue in the next legislative session, and it will be very important to think about what's the most efficient and effective way for states to set this up and to make sure that the exemptions work, right? And the most efficient way is really to do as much of it using available online data, right? So people don't have to do a lot of reporting and, doctors don't have to be writing a lot of notes and all those things. So as much as what we sort of call in the business ex parte, which is when the computer is doing the work, that states can integrate, ex parte approaches to these exemptions. That's going to be very important. And of course, educating people. And I think this will be a really important piece. Um, if states have to implement this work requirement, is so that people understand the exemptions, right? So, like, if you're a parent and you have a dependent child, although we don't have a definition of dependent in the bill, but let's just say, parents theoretically are going to be out. There's lots of ways that can go wrong in real life. And so we'd want to make sure that, first of all, the state is just taking out anyone they know as a parent because their child's on Medicaid. They just out, they don't have to do anything, whatever. But beyond that, educating the community about, okay, well, if you are a parent or you're taking care of a family member with a disability, or you have a SUD condition, you're supposed to be exempt. Like, there's going to be a lot of work that has to be done to educate the community about this because it's very complicated. And similarly with the 6-month renewal, we just know, and we just went through the unwinding, that these processes don't work smoothly. So I think there will be a lot of work there. And then I guess more on the sort of policy side, there's going to be a lot of work to think about revenue sources and how these, payment arrangements are going to shift, and what states can do to make up for some of the federal losses. Again, I don't think there's any way they can make up for all of them, but there will be some sort of more, I guess, wonky analysis that will need to be done on that side of the ledger.
Thank you, Joan. I see that you're getting a couple of compliments in the chat, so thank you again for explaining the bill, for your expertise. I'm going to give it another minute to see if anyone else has any other questions. But if not, just want to reiterate our thank you. And as you were saying earlier, this is not a done deal just yet. And so there is plenty of time to take action, plenty of time to call our senators, Senator Curtis and Senator Lee, to really talk about the impact that it'll have on our state, on our kids, on our rural areas, on our state budget, and on parents who need access to this critical care. And so if you want to, we are hoping to get 100 actions or 100 calls for 100% kids this week. And so if you have a chance, please use this QR code to call your senator today, or call or email your senator. Because again, we want to take 100 actions this week on this issue. As Joan was saying, they're likely, they might actually vote within these next couple of weeks. This might be a done deal or might not be a done deal by July 4th, but either way, I think really having Utah community members like you all share how it'll impact the people that or people within our state, I think is really critical. So thank you again, Joan. Really appreciate you taking the time to chat with us, to really break down this really complicated bill. And thank you everyone who's online for joining us today and who's in person. But with that, we'll close this out and leave you with any last words, Joan, that you might have for us.
Yeah, I'll just say, we are regularly blogging on what's going on with the bill. So if you're not already signed up for our blog summary every Friday, or you just want to come to our website, it's I'll put it in the chat, ccf.georgetown.edu. I put in my colleague's bill explainer, 16 pages, so it might be more than you want, but if you want to look up any of the specific provisions, they're all in there. And so we'll be definitely keeping people up on the action. on our blog and also on Blue Sky and X. I am on both those platforms along with my colleague Edwin Park is on Blue Sky. So we're doing our best to kind of keep people posted on major developments those ways.
Awesome. Thank you so much, Joan. Thank you so much, everyone. Hope you have a great day and hope you all take action today. Thank you all.